Hello everyone, I'm Dr. Priyanka and I'm here to tell you about adenomyosis today. So adenomyosis, what does it mean? So we would split the term into adeno and meiosis. So adeno means gland, that is the inner lining of the womb or the uterus, which is called as the endometrium. Meiosis is the growth of this tissue in the myometrium. So in adenomyosis, what happens? This inner lining, it starts to grow inside the muscle layer, and because of which, as it keeps on growing, the uterus becomes very bulky and enlarged in size. So that is what is adenomyosis, and it is quite prevalent. It can be seen in up to 40 to 70% of the women, and many a times it will not be diagnosed because there will be no symptoms, but very often there are symptoms, like you may experience very heavy or prolonged bleeding during menstrual cycles. There may be a lot of cramping during the periods, or some women may experience heaviness or bloating in the abdomen during their periods. So these signs could be suggestive of adenomyosis. Now the question arises, what really causes it? Why does it happen? The exact cause is not known, but most often it is seen in women who are in their third and fourth decades. So usually after 30 years it starts, usually around 40 to 50 years of age. It is more often seen in women who have already had a pregnancy earlier, and sometimes it has also been associated with use of certain hormones, though it is not strongly proven what exactly causes it. And now when this problem happens, what other things we need to keep in mind? So as I'm a fertility specialist, I'll be dealing more about the fertility aspect of it. So it can, first of all, it will impact your menstrual cycles, making you very uncomfortable during the periods. Then women who have adenomyosis, they may have or they may experience miscarriages or preterm deliveries because the uterus is very enlarged in size, because of which it does not function in the correct way. So these are the problems. Very often we also see women having little difficulty in conceiving because with adenomyosis, the endometrial gland, which was supposed to be only inside or had to be in the inner layer of the uterus, it has now gone and sat into some other place. So it will affect the attachment of the embryo, and it can affect the embryo growth as well. So what would be the treatment options? So as I was saying, it would depend upon what is your age group and what is your fertility status. If you have a child and if you are experiencing severe pain and menstrual problems, your treatment would be different. But if you're planning for pregnancy, the treatment is totally different. So for a woman who already has a child and experiencing these symptoms, treatment would be by giving painkillers, which would reduce your cramping, and also treatment to reduce your bleeding during the periods. So there are various hormonal treatments which are available. Even intrauterine devices like Mirena are available, which will help in effectively reducing your symptoms. But women who are planning for pregnancy, they have to undergo a different type of treatment. So there we usually give them injections, which would either be monthly or 3 monthly injections to help in the uterus to come back to its normal size, or it helps in shrinking the uterus. So basically these hormones will suppress the growth of these glands inside the myometrium and make the uterus more favorable for the pregnancy to continue. So if you experience any of these symptoms and you have any of these problems, you must consult your fertility specialist, get yourself evaluated. So now many women would ask, what do we do now? Like, how do we know whether we have adenomyosis or not? So if your symptoms are suggestive, then your doctor will usually do a pelvic examination where we will notice that the uterus is bigger than how it should be. We have to do a ultrasound, usually a transvaginal ultrasound, to see how the uterus is looking, and to confirm accurately adenomyosis, we must do a MRI. So MRI is only for confirmation, especially when we have doubt whether it is a fibroid, in cases where it is localized. So other thing which I wanted to tell is adenomyosis can either be local or it can be diffuse. So it can be in certain spots or it can be throughout the uterus. So when it is in particular spots or it is localized, then a lot of times it gets confused, or we may have confusion whether it is a fibroid or whether it is a entity called adenomyoma. In those cases, MRI gives a lot of information, because the treatment is totally different if it is adenomyosis or if it is fibroid. So keep these things in mind, and if you have any of these symptoms, please consult your gynecologist or fertility specialist. I hope this information is useful. Thank you.